So wisdom teeth, how has it changed? You say it's much better now than it was years ago.
I say better in that it's just a faster procedure. The equipment we use, the technology that's evolved with removing wisdom teeth is just better than it was years ago. So it's a much quicker procedure. I wouldn't say painless, but it's definitely less pain than years ago.
But by the next day, they're fine.
Correct. That first evening or first night is the worst time, and patients typically are on pain medication during that time. But by the second day, they're out and about and they're conducting their regular routines.
They go back to work, whatever.
Yes, they may have some swelling, but they're back to work.
Now tell me this. Okay, so 17, 18 years old. I mean, when should somebody, parents watching this, when should they maybe look at wisdom teeth being taken out?
I think the most ideal period is between age of 16 and 18 for a couple of reasons. One, the teeth are easier to remove. There's less complications during the procedure and after procedure. The patients heal well afterwards. And fourthly, if the student, that teenager, is going to college and they're going out of town, it's nice to have those wisdom teeth out of the way so they don't have any problems studying for tests or finals later on when the gums get swollen or the tooth starts aching or they're having some type of discomfort when they're in school.
Okay, what are the symptoms, by the way, of when you know wisdom teeth need to be taken out?
Correct. There's a few symptoms. They can be pain. There could be crowding or shifting of the front teeth. There could be no symptoms. There could be something going on where there's pressure occurring on the tooth in front of the wisdom tooth, but it doesn't cause any pain. So it's best to have it checked out by either your dentist or your oral surgeon before symptoms occur, or just to find out what's going on.
We talked on the telephone because for me, I thought, well, if you have no symptoms, like it doesn't hurt, your teeth aren't shifting, why then get them taken out?
Sometimes the angles that wisdom teeth, and I brought models and I use this during my consults, is that sometimes the angle that wisdom teeth are in is creating a problem that can cause discomfort or cannot cause discomfort.
But if they grow in wrong, they could make you lose the other teeth later on.
Correct. If they stay impacted, sometimes cysts or tumors can develop around them. Again, this is a painless process. A person doesn't know often unless they get a routine radiograph or something more dramatic happens, like their jaw fractures or weakens. And in fact, I have a patient I'm currently getting ready to see who's a professional soccer player, has an impacted tooth. He got a routine x-ray and he has a lemon-sized cyst in his jaw that now he's aware of, that he wasn't aware of. He's 23 years old. They now needs removed, but there's the risk of a fracture or broken jaw because of this.
So everyone should have their wisdom teeth taken out?
Not necessarily.
Okay.
They just need to have them checked.
Like and then through an x-ray, through what? Through imaging?
An x-ray is probably the best way to go.
To find out if they're coming in all right.
Correct, exactly. I would say, with my history or experience, I would say it's probably best that about 80% of the population will end up or should have their wisdom teeth removed, but there's a good 20% that probably don't need their wisdom teeth removed at all.